Start. Good afternoon. I'm Dr. Puneet Buania, consultant nephrologist at Wockhardt Hospital, Mira Road. Today I'll be talking about the most important topic and the need of the hour, organ donation, with a special mention about kidney donation. So before I start talking about kidney donation and organ donation, I would like to let the viewers know about the current magnitude of the problem. So every year, around 1 lakh chronic kidney disease patients are being diagnosed. And out of the 1 lakh, 50,000 of them require kidney transplantation every year. And if then the number of transplant done in a year are very minimal. That I would say is around 10,000. And out of 10,000, 8,000 are live donation and 2,000 are cadaver donation. So the viewers would like to ask me what is live donation and cadaver donation. So when we talk about donation, donation is divided into two topics. One is live donation, when your relative is requiring a kidney and you tend to give the kidney to the relative after due testing. And other is cadaver donation. That is when you pledge your organs for donation, and when after your untimely death, your organs are being given to patients who are in the list for donation. So when we talk about kidney donation, I get many questions. What will be my life after kidney donation? What do I need to do? What precautions do I need to take? So I'll be talking about each one of them in small brief and in detail. So once we talk, let's start about kidney donation. So what I would like to say is kidney donation. God has been very kind to us. He's given us two kidneys, and what I believe is one kidney has been given to us in spare. And why do I say so? It is like if we give up one kidney to the patient, the other kidney tends to work 20 to 30% extra. And sometimes we don't even know that we have a single kidney. We tend to find out when we do a routine investigation, we do an ultrasound to find out that we have a single kidney functioning. So, in that sense, human beings are lucky when we say that we have two kidneys. So, what are the do's and don'ts and the precautions we need to take before we decide to do kidney donation or pledge our organs for cadaver donation? So, if we do end up giving our kidney to our relatives or we do end up pledging our organs, so what precautions do we need to do? First is you need to take good care of your health. Kidney donation, on the contrary, has a beneficial effect to the donor. And why do I say so? When we donate our kidney, we become a little more conscious about our health. We start taking care of our health seriously. We start doing investigations regularly. We take care of our diet. We don't take undue medicines. So these are the simple precautions we need to do. So if we are a kidney donor, so the first thing we need to do is do investigations regularly and get a medical checkup done every 6 months. So when I say investigations, I mean sonography, I mean a serum creatinine, and I mean a urine test. So these have to be done every 6 months. Next thing is we need to check our blood pressure regularly. Third thing, we need to avoid any other medications which are not being prescribed by a doctor. When I say any other medications, I mean any other over the counter medications like painkillers, which we take for a usual headache or a back pain. This has to be prescribed by a doctor, and he should be aware that you're a kidney donor. Another thing is sometimes when we do get fever, we tend to take it a little lightly. Yes, it's just a regular viral fever or it's a bacteria or it's something else. But then once you're a kidney donor, you can't take anything lightly. Fifth thing, all the investigations and your diet. Your diet is the most important thing. So once you become a kidney donor, you need to cut down on your salt a little. Sixth thing, am I audible? Yeah. So, and the other things. So once you do get an infection, you need to be very much careful about it. So now comes how do we donate our kidneys and how do we donate our organs? So there are two ways to do that. One, you can log on to organindia.org and go through the process and fill up the form. And the other way is you can just search me on Google. You can go to my updates and there is a QR code which you can just scan and it will redirect you to the page. I would like to share a case which happened with me last week. One of our patients who had registered with us 4 years back, and I repeat myself, 4 years back, recently got a kidney last week. And that you would be surprised to know who the donor was. A donor was a person who had pledged his organs 20 years back, and at the age of 70, when he died due to some road traffic accident, his kidneys were donated to him. Just imagine a 70-year-old person can do this Why can't we? So I would like to say kidney donation is the most important thing. And just not kidney donation, any organ donation. If we decide to pledge our organs, in turn, one person could save up to 8 lives. So the thing lastly I would like to say is not everybody can be a hero, but this is your chance to be a hero by donating your organs. I would like to, if there are any questions, I would like to take those questions. Thank you. Any questions? So if there are no further questions, you can even write to me on my email address, or you can write to us at vocardhospitals.com. And if there are any queries, if you have any relatives who are being diagnosed with chronic kidney disease, who needs a kidney transplant, and you are a fit donor, you can visit us at Vocard Hospitals, Bira Road. We are there 24 hours to help you out and help you have a better life after that.
So now we got a one question that how would I know if I have a kidney disease?
Okay. So that's a very good question. That's an apt question. So there are when we talk about kidney disease, we divide into symptoms, signs, and investigations. So generally, 60% of the people do have symptoms, but there are patients, 40% patients who don't have any symptoms. So when we talk about symptoms, we talk about leg swelling, we talk about some foamy urine, we talk about uncontrolled blood pressure. So these are some of the symptoms when we are thinking that we have a kidney disease. So even if we don't have symptoms, we are scared that there is a family history of kidney disease. How do we know that we have kidney disease? Then we do certain investigations. Investigations are like blood investigations where we do serum creatinine, where we do serum electrolytes, where we do a urine investigation to find out whether there's any protein leak or blood leak in the urine. And the last is sonography. That helps us finding out what is the outer structure or outer state of the kidney. This tells us whether there's any kidney stone or whether the kidneys are damaged due to some other infections or any other diseases or not. So these are some of the ways where we can find out that we have kidney disease. If you do have kidney disease, please don't ignore it. The earlier the kidney disease are diagnosed, the earlier the treatment is given, the kidney disease can be reversed. But if we ignore it for a longer time, the kidney disease, which initially starts from an acute kidney injury, can become a chronic kidney injury.
So we got a second question. What are the common cause of kidney diseases?
Okay. So generally in India, 60% of the kidney problems are due to diabetes and purely uncontrolled diabetes. So like if we are in the age of 30s and 40s, we are diagnosed to have diabetes. At that very point of time, we need to even get a kidney evaluation done, because most of the times kidney diseases begin with the diabetes. In the earlier days when diabetes was a little rare commodity, that time the kidney disease used to take around 10 to 15 years to develop. But during the current times where our habits are very bad, where we tend to indulge into junk foods and are taking undue medications, kidney disease and diabetes begin together. And then uncontrolled diabetes is one of the risk factors why a normal kidney can become a chronic kidney disease. The next in line comes hypertension. So hypertension is a two-way sword. A kidney disease patient can develop new onset BP, while a BP patient or a hypertensive patient can develop kidney problems. So if you have hypertension, please make sure your hypertensions are well controlled. If your blood pressure is well controlled, your kidney disease would be lesser, or your kidney disease would be very less. The other commodities are whether you'll be having a family history, whether there is any kidney stone in the past. So these are some of the problems, and the others are glomerulonephritis. These are diseases which this is like, if I put it in simple terms, this is like an allergic kind of disease where body tries to make antibodies and tries to break the kidney. So this can be only found out when we do certain blood investigations and kidney biopsy. So kidney biopsy is a commodity. When we talk about biopsy, everybody thinks, okay, biopsy, it means cancer. No, biopsy does not equate to cancer. Biopsy is just a way to find out what's exactly happening in the kidney. And once we know what is exactly happening in the kidney, we can give adequate and appropriate treatment for it so that the kidney disease can be tackled at an early stage.
One more question we got that the person said that I have had high blood pressure for a long time. Is it that normal?
So high blood pressure, as I said this just 2 minutes back, high blood pressure and kidney disease both go hand in hand. The higher the blood pressure, the higher the kidney problems. And it's the other way around as well. The uncontrolled the kidney problem, the higher the blood pressure can be. So if you have high blood pressure, please get yourself evaluated whether it is because of the kidney or whether it's because of something other reason other than the kidney which is causing your blood pressure. And please get yourself checked and your blood pressure controlled. The sooner you control your blood pressure, the faster your kidney will recover.
Okay, one more question we got that. How does kidney disease cause anemia?
Okay. So generally, when we talk about kidney disease, kidney does not only means kidney and urine. So kidney has many other functions. One function, one of those function is producing a hormone called as erythropoietin. So when we tend to develop a kidney problem, the hormone production of erythropoietin is very less. And that is the reason why kidney patients tend to have a low hemoglobin or otherwise called as anemia. So when a kidney patient goes into dialysis or the kidney problems are worsening, we tend to supplement the patient with something called as erythropoietin. This is the hormone which the kidney should produce, but as it is not producing because of failure, we give a supplementation of it. So that is the reason why kidney patients and anemia go hand in hand.
Okay, one more question we got right now. What drugs are harmful to the kidneys?
Okay. So if I look at all the drugs, most of the drugs, as we know, obviously when drugs have an use, they have a side effect as well. So most of the drugs do have some effect on the kidney, but then yes, majority when I talk about harmful drugs, it is most of the times painkillers. Painkillers which have been not prescribed by doctors, which have been taken over the counter. It's like we go to the pharmacy, we have back pain, we take any painkiller. No, these are the painkillers which could cause majority of the problems. Other thing is when patient has kidney problems, we generally tend to view the TV, we tend to find out some ads, okay, you take this medicine, you take that medicine, that will help you in control your kidney. But no, most of the patients, what we see is when they have kidney problem, they end up taking those other medicines which are not being prescribed by a regular allopathic doctor, tend to develop and tend to have a faster kidney progression as compared to patients who are on regular allopathic medicines. So these are certain painkillers. Most of the time, it's the painkillers which are the cause of kidney problems.
Okay, one very interesting question right now I got that. How can I protect my kidneys if I take medicines to treat a health condition?
Okay. So the most important thing first you need to do is always if you feel that your kidneys are getting involved or kidneys are getting affected with the medicines you're taking, first go and visit your nephrologist nearby. Let him know that this is your medical condition, these are the medications you're taking. So according to your kidney state, the medication doses can be changed. Medication doses can be given according to what your kidney needs, or if the medicines are not suiting your kidney, the medicines can be changed. It is not that there is one condition has only one medicine. Always there are multiple medicines or multiple ways to treat the same condition. So if you have a kidney problem and you feel that the doctor feels that the medicine is affecting your kidney, he'll give you a substitute medicine at a dose which your kidneys can tolerate. On the flip side, help your condition as well.
Okay, again one question we get that. What foods should I avoid for my kidney health?
Yeah. So the most important thing, the most important thing, and I stress most important thing for the kidneys is your salt intake. If you have kidney problems, if you have blood pressure, your salt intake has to be less. And when I say salt intake, it generally means outside junk food. Majority of the outside junk foods need salt to keep the food fresh and to keep it tasty. So if you have home cooked food with less salt, your kidneys will never be harmed. But then if you indulge in eating outside food, if you indulge in eating packed foods, you are causing your kidneys to fail fast. So when I say what foods, as your question says, what foods, I would only say one thing: take care of your salt. The kidneys will take care of you.
Okay, again one you were sent the question that how does my doctor know I need to have a dialysis or get a transplant?
Okay. So kidney stages are generally divided or are staged into 1 to 5. So when you do a blood investigations, you do a creatinine, you do a urine, you do a ultrasound, and you do a urine protein quantification. That lets us know what is the stage of the kidney. So once your kidney is in CKD stage 5, when I say CKD stage 5, I mean when the kidneys are functioning less than 5%. It's at that point of time your doctor would ask you, or your doctor would decide whether you need dialysis or not. Not dialysis is not only judged on the basis of creatinine. Dialysis on is judged on the requirement of the patient. Like with a creatinine of 5, some patients with a creatinine of only 5 go to dialysis. Why? Because they develop breathing problems. They develop severe anemia. They develop increased toxins level in the body. While I have certain patients with a creatinine of 15 who are not in dialysis because they don't have these symptoms. So patient symptoms, patient's creatinine, and how they respond to the treatment decides whether you need dialysis or not. Coming to whether you need a transplantation, yes, once your creatinine or once your kidney functions are less than 15%, if you don't want to undergo dialysis, transplant is the best option available anywhere in the world. So if you do transplant before starting dialysis, your transplant survival, or I would say a graft survival, is much better than a patient who does transplant after doing dialysis. So if you have someone, if your relative who is willing to donate a kidney to you and your kidney functions are less than 15%, somewhere around 10%, 5%, and your doctor's advised transplant, please, I would suggest get a transplant done before you go into dialysis so that your life after transplant is much, much better. So if there are no any more questions, I
No,
will.
still there is no any questions.
Okay. So we wait for 1 more minute. I hope I've been able to answer most of your questions. If there are any more questions, you are free to meet us at Wokhad Hospital, Mira
Yeah,
Road.
one more question we get, that non-alcoholic fatty kidney disease.
Okay.
Yeah.
So generally, non-alcoholic, there's an entity called as non-alcoholic fatty liver disease. Yes, there is some entity called as kidney disease also, but then that needs an evaluation to be done for it. We cannot directly label a condition called the non-alcoholic fatty kidney disease. All kidney disease have a reason. When you get, so how do we need to find a reason? As I said, we need to do investigations. We need to do kidney biopsy to find out what is the reason. But generally, the entity called as non-alcoholic, it is non-alcoholic fatty liver disease and not kidney disease.
There is one more question we can get. Genetic testing in kidney diseases. What is the genetic testing in kidney diseases?
Yes. So who needs to undergo genetic testing? This is the most important thing. So if you have a family history of kidney disease, like if your parents have a family history, or your grandparents or your siblings have a family history of kidney disease, this is one. Second thing is if your family history, there's a history of recurrent kidney stones, or if you in your past you have had a history of nephrotic syndrome. These are certain conditions where you need to do a genetic testing. Genetic testing includes whole exome sequencing. So these are some of the screenings we need to do. And depending on the past history of your family, the genetic testings are divided according to the suspicion of the disease.
Okay.
So there's whole genome sequencing, there is whole exome sequencing. These are certain multiple genetic testings we need to do. So there are no further questions.
No,
So-
still we are not getting any questions.
So hope I was able to answer most of your questions. Thank you for being, uh, thank you for listening and being a patient viewer. So, so anything regarding organ donation, please visit organindia.org, or you can visit us, or you can search my name on Google and you can scan the QR code to find out more about organ donation. Thank you. Thank you.